Oh, love this case. It's very interesting because there's two baby teeth. And then you're probably thinking like, wait, how can you do a veneer on a baby tooth? Here's the thing. If a baby tooth is hard and it's solid inside the bone, there's no reason to take it out unless there's decay or it's loose or it's weak or you think it's gonna fall out. Here's a case that was done 3 years ago and it's still in the mouth, and let's kind of go through it. Front teeth are definitely long and boxy, and then you can see this tooth is small, and then this little baby tooth is quite small too. We got two baby teeth. We got one and we got two. So if we look from the angle, the edge of this tooth is actually in a fine position. Just the whole smile kind of goes up, and then there's discoloration, and it's quite triangular in that region, whereas a true adult canine has more volume. So if you go back to kind of looking at this, I'm going to laser the tissue, create the tissue to look exactly the way that we want the veneer to be placed on, and then honestly it's a minimal preparation, because if we know that we're going longer in this smile with these teeth, then this canine is going longer too, and then this tooth is going over here, then honestly, and I don't like the fact that that front tooth is kind of tilted backwards, so we're going to actually bring it forward a little bit. So the reshaping of the tooth is going to all be from the back, and then the veneers will kind of go more in this position. So here's the way that I'm going before I start prepping. Since I know that I'm adding to that front portion of the tooth, this is where it's not touched, and then this is the additive mock-up approach to the smile. I already know where I'm going with the smile, but this kind of could be used as a guide sometimes. And then here's the preparations. So you see how this has the exact same shape? These tissue over here, it looks a little bit rough. The reason it does that is because I laser that area. The veneer is going to slip over, and then the tissue is going to heal around. You can see how these teeth are basically the exact same position. Then the veneers will now pretty much go like this. So all of this will be additive porcelain. So I'm going to show you where we went with this case. But first, we bleached the bottoms, and when we bleach the bottoms to match the color of the top, we want to also know how light did it bleach. So once we bleached it, we knew we got this color. Now the permanents can be a little bit lighter. These on the top are all temporaries. So when the patient comes back a day or two later, we review the temporaries and we choose the color. Here are the veneers on the model. Remember I said we were going longer, so that's exactly what we did. Remember how thin we were going over here, because that's where the natural tooth is, and then these look like actual canines. Here you can see how we wrapped that around and how much porcelain needed to be added because that baby tooth was short, and now we added length to it. As well, as always, I try to be as minimal as possible with these cases. This is the final. Here she is. That's the side. You can see how the tissue looks there. This is now her smile. You can see balance. You cannot even identify which one is the baby tooth and which one is the adult teeth. As you look from the side profile, you can see how the tissue looks really healthy around that veneer. This is 3 years later. The top teeth look natural and pretty much identical to her own natural teeth.